Welcome back to Fox 51 Good Day, and we're here with Jenny from Net Health. Thanks for joining us this morning.
Yes, thanks for having me.
And we know this month is all about raising awareness for premature birth rates.
Yes.
So why don't you talk a little bit about what that looks like here in Texas?
Okay, so in Texas, about 10% of babies are born prematurely, so that means they're born before the 37th week, and it can cause a lot of complications for them as infants and later on in life, a lot of stress on the family, long hospital stays, and so our coalition really works to try to decrease that rate. In East Texas, our rates are pretty similar to those in Texas. In some counties, a little bit worse. So, that's 1 in 10 babies that are born prematurely. So we're trying to, help create better health outcomes for babies and moms. Mm-hmm.
And I know that you mentioned health complications. It can be difficult for the mother as well when that happens. Do you want to talk a little bit about that?
Yeah. So, really, we've tried to focus a lot on women's health even before conception, because that contributes a lot to a healthy pregnancy and then having a healthy full-term baby. So encouraging moms to go to 39 or 40 weeks. But if babies are, the earlier they're born, the more complications could arise. And so, like issues with lungs, certain chronic conditions that can last throughout their lifetime. And so if we can get all those pregnancies, if we can have them go to 39, 40 weeks, it just helps with better health outcomes and healthy babies. So that's our goal.
And I know there are groups that are working towards that goal that you mentioned here in East Texas. Do you kind of want to talk about who they are and what they're doing?
Yes, so the Healthy Me, Healthy Babies Coalition meets monthly and really works towards targeting, like, for example, women's health, making sure women are connected to health care, making sure, they have a healthy pregnancy. So working with lots of different people from different backgrounds in the community to help raise awareness. So the WIC program is involved. Healthcare providers get involved in the coalition so that they can talk about the things that contribute and focus more on those areas like stress, things that, we used to not realize that stress can, really cause some issues during pregnancy and lead to certain birth outcomes. So that's something, that we've started focusing on more as well. And then also looking at the different socioeconomic groups and different groups in the community that it affects the most, so that, they can really target their efforts towards those groups.
Great. We don't have a ton of time left, but I was just wondering, I know you have an event coming up that you wanted to mention. So do you want to tell us about that?
Yeah, so there's a kickoff luncheon for a March of Dimes prematurity awareness luncheon that's on Wednesday, November 13th. It's at 11:30 at the Rose Garden Center. Tickets are $30. All proceeds go to March of Dimes to help further research in those areas to help, help our babies have better outcomes.
So great. And I know, people may have more questions or want more information about this, maybe even get connected with some of those groups you mentioned. Is there a website or something they can go to?
Yeah, so the Healthy Me, Healthy Babies Coalition Facebook page is really the best place to keep up with what's going on in the coalition and in the community. You can also call us at our WIC office is 903-593-8331 if you have questions or maybe want to get tickets for the event.
Well, great. Thank you so much for being here this morning, Jenny.
Thanks for having me.